I just received the autopsy report for Kevin Samuels, and I want to go over the entire thing with you. All 17 pages as quickly as I can. In some ways, the report shocks me at how normal it is. There's no big smoking gun. People thought this might have been a true crime case. People thought this may have turned into a true crime case. That's why plenty of us followed it, but it looks like it's just a natural cause of death. If you had never heard of Kevin Samuels, he was a very popular YouTube star who was 53 years of age. And then, all of a sudden, one morning in Atlanta, he died unexpectedly. And he died in the company of a nurse. Her name was Altencia Alcantara, and she was only 32 years of age. If you haven't heard the 911 call, listen to the whole thing I've linked to below. It's 17 minutes. It's kind of sad and shocking and frustrating. Kevin Samuels seemed as though he was the picture of health in his YouTube videos. And I guess he sort of seemed like he had a youthful spirit. And so that's why people were shocked when he died in the company of this young lady who now seems completely absolved of any suspicion that people were lobbing her way. Once you see this whole report I got, of course, the suspicions and the tinfoil hats and conspiracies started to flow. Some people thought, oh wow, he was, really about to break out, the height of his fame. He was 53, but he was really gaining so many subscribers, more than 1 million. His shtick, as I call it, was making him really popular. A lot of people loved him, a lot of people hated him. I've watched so many of his videos, and I can see both sides. And I can also see why his ex-wives likely divorced him. I have so many conflicting emotions, but I'm just going to get into the report and we will talk about it. We are going to find out that Kevin died from hypertension, which is high blood pressure, and we will see his pre-diabetic state. There were all these theories from people asking, was Kevin poisoned? Did this woman slip something in his drink? And so many different oddities going on. As I read this report, and you will see, it's more concerning to me that Kevin and I were the exact same age. So he was born in 1969, I believe it was March, and I was born in April 1969. So we are both 53 years of age. There was some confusion. Some people thought he was 57 years of age, but I don't know where that came from. He was 53, like me. That's why I was so curious to see his cause of death finally come out. I watched a ton of his videos. I see why people were hating on him. I want to be very sensitive because I watched his funeral and everything. And although Kevin, I believe, had a lot of hateful things to say, especially about women, especially about older women, especially about black women, especially about women who weren't maybe a size 0. I always wondered, oh my goodness, if I had ever called in, what would he say to me? I don't think I'd want to hear it. The only person who matters, Jesus. That's the only one who matters about his opinion of me and whether I'm living right by him. And that's another thing I'm going to weave into this because I've researched so much about Kevin, and supposedly he called himself a Christian. I pray he really is with the Lord now. I'm not jumping on this bandwagon of hate, even though he may have spouted hateful things. And some people claim they weren't hateful. They're like, you had to watch him. You're taking it out of context. And I don't like to do that. I don't like to just watch clips. I've probably watched maybe 100 of this guy's videos thus far. I do feel like he was a kind of fake it till you make it type of guy. I am concerned about the way he likely treated his ex-wives. You can find more about that online. What's also concerning is, there's no fool like an old fool. I didn't jump on the man-hating bandwagon. I know this is a man who has a soul. No one should celebrate his death. But I will tell you honestly, when I saw Kevin Samuels' name trending on Twitter when he died, I kind of ignored it. And then when I first saw reports claiming he died, I really didn't believe it. And when I finally believed it, my first thought was, God's not playing. And I do not mean that in the sense at all that, God struck him down. It was just my first thought, like God is not playing with us and how we present ourselves. Before I read this long autopsy report, I'll give you a little backstory. Kevin Samuels seemed to have started his career from the videos I found, selling cologne and stuff, and he was in his car and he was giving pretty practical advice down there in Atlanta. He would give advice to men to work hard, and he would give pretty practical advice. But then somewhere there was a shift, and that that advice became pretty harsh. Some women, gluttons for punishment, would call into his show, ask for advice. Some men were happy to see these women humbled if some woman thought too highly of herself or was too picky about the type of man she wanted. Kevin would supposedly set them straight. The video that went viral was one woman where he told her, "You're average at best." And he referenced different studies where it alluded to or quoted women over 35 in certain countries being viewed as leftovers. That was his shtick. And that's why a lot of people hated him. And that's why his autopsy was so important, because people thought someone finally took him out. But no, there would be indications with heart issues and other things. But for the most part, you will see, we don't see illicit drugs. We don't see poison. We don't see the coroner or medical examiner saying something nefarious happened. So beyond the natural, which we'll look at, there is the spiritual. It's confusing when someone calls themselves a Christian, but they're not walking in the love of Christ. It became popular for him to kind of supposedly give it to people straight and be a little rude and call a woman a linebacker. Hut, 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 hut. Would he be calling me a linebacker? He actually weighed a little bit more than I thought he weighed, even though on camera he looked very tall and slim and he was just making it. He starred in Donald Glover's Atlanta show on FX, so it was like this trajectory, but he found his niche, and that niche almost turned, in my opinion, into a woman-hating type of show. Some people will say, well, he gave it to men too. Whatever. I can recognize when people are shifting. And those are the type of channels in general that I stay away from. There doesn't need to be this type of fakery that happens because you find it hits, because you find this segment of incels that are willing to buy into your shtick, your hate or fear mongering, and I don't like that. You know, I could easily maybe find a niche if I turn this into some man-hating channel, or whatever hating channel, but why would I do that? I'm married to a man I love. I have a son I love. I mean, why focus on hate? But hate is what kind of got him where he was. It just ended abruptly. And it's making me think a lot about purpose and everything. So let's get into this autopsy report. It was from the medical examiner, and they sent it over to me today, Monday, July 18th. First, we have from Grady that Kevin Samuels, 53 years of age, from the Department of Pathology and Laboratory Medicine down there in Atlanta, they collected 2 samples of blood and 1 sample of bodily fluid. One final result shows that beta-hydroxybutyrate, it is some kind of chemical that is made by the body. It provides energy when not enough carbs or sugars have been eaten. I don't really know Kevin Samuels' diet. I do know from his videos you see him drinking tons and tons of Red Bull. And then we see normal components. Everything else looks pretty normal. Urea, nitrogen, glucose, creatinine, sodium, potassium, chloride, but it does show his A1C value is at 6.1. That indicates a pre-diabetic state. 6.4 and above indicates diabetes. I'm not sure if he ever spoke of that. I know Kevin Samuels finally at one point admitted that he didn't graduate from college because he said he suffered from a bout of cancer. Other than that, I don't remember him referencing in the videos I watched any health conditions. I know he was down in the Red Bull, he needed the energy. I do know he spoke about injecting himself or getting testosterone injections. That's about all I remember from the hundreds of hours I watched of his videos. That pathology report was 1 page. Now let's go to the 8-page forensic toxicology report. It doesn't give a date of death. It's a comprehensive drug panel, blood drug panel. As we go over these blood test results, I think it's important to pay attention to what he didn't have in his system as well as what was positively identified in his system. All these volatiles are negative: methanol, ethanol, acetone, isopropanol. Now it does say positive for amphetamines, which for a second we're like, uh-oh. Pseudoephedrine is used to relieve nasal congestion caused by colds, allergies, and hay fever. So it's just a decongestant which can treat stuffy nose and sinuses, just like it's found in Sudafed. Treats other respiratory allergies. It was taken off the market. In 2005, the FDA created some Combat Methamphetamine Epidemic Act, which banned over-the-counter sales of cold medicines that included the ingredient pseudoephedrine, requiring them to be sold behind the counter. And it's okay to use Sudafed daily, but only over a short period of time. Kevin apparently was over the reporting limit of 50 with this pseudoephedrine. He was at 173. We'd have to leave it up to a doctor to know if he was taking something like Sudafed or what have you. Was he taking it too often or just right, or was it found in something else he was taking? We don't know. Some of his viewers claimed he would, pop by the gas stations and buy those, how they market all that stuff to men, strong like bull. We don't know what's in that crap. I don't know if he honestly took something like that, but if that contributed to his demise, I believe one thing we can learn from Kevin's death is that we have to be careful with a lot of these products, even so-called health supplements, even so-called natural health supplements. During my fitness competition days, I did take ephedra extract, and that could be, supposedly so natural, and it helps you lose weight, get in shape, but I don't recommend it at all. It affected my breathing, and thank God, I just said, I'm not taking this anymore. Certain things that can be effective with weight loss can be dangerous, especially if you have some underlying condition you don't know about. So maybe Kevin didn't know if some of the things he was putting in his own body may have been harming him. Sometimes we don't know, and we thank God for second, third, 15, a billion chances. And unfortunately, it seems Kevin's chances ran out. While he was espousing this kind of philosophy, high value man, who cares if you're 53, just get your money. And there's all these rumors about whether he just really rented his clothes and, made his setup seem like he was all that. And I don't know whose apartment it was. There's so many questions. I mean, I'm sure he made some good money, but he was exposed when he hadn't finished paying his child support, but I guess he paid all that off. I guess the hate comes from the fact that he got online preaching to others, especially our young men, about, and older men, get yours, you're a high value man, go for it, work until you can, get that money, and then you can just, in essence, the message seemed to be, you can get that young chick because you need that money to get that young chick. He didn't really tell men that I could find how to keep up with that young chick, because a 53-year-old man won't necessarily perform like a 23-year-old man. He might have the money, maybe, but when it gets down to the get down, is he going to have to use extra stuff to keep up with the young chick that he might infer are more valuable? And also, what is the message to women? Women like me, if you need to take off pounds, some women internalize that and start doing dangerous things to take off those pounds to try and not be the linebacker, We can't get caught in that trap. This is a study in what could have gone wrong with trying to fake the funk and be this image on YouTube that's not real. Or in real life, that's not healthy. Maybe the message from Kevin's death is, okay, if the marriages didn't work out, life happens, but you don't need to go preaching, go chase these young women. And I don't know, it's such a dichotomy. His whole situation was such a dichotomy. Maybe he wanted to stay with his wife, but I would have been more impressed if he were a 53-year-old man telling younger men and women, look, my wife and I went through some hard times, and this is how we made it work. And we've been married 25 years by the grace of God. I mean, I know he used to run a singles ministry or a marriage ministry. He talked about ministries. So it was just so odd to me that he's on there on YouTube as a Christian, kind of dogging out people for the way they looked. Or he didn't even seemingly like, or maybe he was threatened by successful women who were a bit too above it. And I get it. I don't want anyone to act more highly than they should, man or woman. I don't want anyone thinking, oh, I got it going on, so I deserve a man with 6 figures, a Bentley, and I need to get the bags and all that. No, I'm not saying be that way, but I'm saying there is someone for everyone. We pray to God for a good mate. no matter what size, no matter what race, no matter how you look. That's my philosophy. If any of the substances we learn in here are somehow related to him trying to keep himself in shape and keep up with the young women, it could be a cautionary tale. So we see a lot of negatives: no antidepressants, no anti-diabetics. Again, it's kind of surprising that he was pre-diabetic. No antihistamines, no antipsychotics, no barbiturates, no benzos, no cannabinoids. Now, when it comes to cardiovascular, there is a positive for aminodarone. Aminodarone is used to treat life-threatening heart rhythm problems called ventricular arrhythmias. This medicine is used in patients who have already been treated with other medicines that did not work well. Now, the side effects are coughs, dizziness, fever, painful breathing, trouble with walking, trembling. It's used to treat and prevent an irregular heartbeat. It slows down nerve activity in the heart. It relaxes an overactive heart. So part of me is wondering, was this a medication that was administered to Kevin right when the paramedics got there? Or is this something that he had been taking prior to his death? That's the confusing part. It might have been something just injected when the paramedics showed up. In extreme clinical emergency, amiodarone may, at the discretion of the clinician, be given as a slow injection over a minimum of 3 minutes. So they might have known something's going on with his heart. When you hear the 911 call, the woman sounds desperate. She's a nurse. She sounds desperate. She knows something's going wrong. You know, she was giving him CPR. Obviously, it wasn't working. Maybe that aminodarone was just administered, and that's why perhaps it showed up right there in his autopsy, because it was still in his system. The only other couple of things we see: analyte was qualitatively positive but has not been confirmed by an alternate analytical method. An analyte is a chemical substance that is the subject of chemical analysis. So we don't really know what that is. It's just another word for analyte as a bit, fragment, segment, or part. We have atenolol that's positive as well. Atenolol is a beta blocker that affects the heart and circulation, blood flow through the arteries and veins. It's used to treat chest pain and high blood pressure. We know his cause of death is going to be high blood pressure, so it makes sense that he would be taking this. Ironically, atenolol is used to lower the risk of death after a heart attack. I don't know if he ever suffered from a heart attack previously.
Panic attacks, concussion. I went to the emergency room twice, thinking I was having a heart attack. It was panic attacks. Evicted, car repossessed, divorced. The world was falling apart. Good man, good husband, good father, good stepfather. My pet bird that I raised from a hatchling, he's a parrot, a collector's parrot, got him the same month my daughter was born. They grew up together. He was at my ex's place because I had to move from there. Bird loved her, loved her. She killed him. Killed him through neglect. Bird got an infection because she wouldn't change the cage. He was sitting there standing in feces-filled water.
And of course, we've got positive for caffeine, which I'm assuming most people on the planet would be positive for caffeine. Once again, the way he was always throwing back those Red Bulls, that would be expected. And people would notice just too how gassy and burpy he was too. So we knew there was something going on. No one could have predicted it would end like this. Now I know to young people, 53 might sound really old, but I can tell you as a 53-year-old, it still feels young. You really still feel like you have so much time left. Like I want to have so much time left in terms of being with my family and fulfilling my purpose. Was Kevin Samuels just going down that wrong path? And would he have continued to go down the wrong path of kind of, making fun of overweight women, or making himself seem like he was just so had it all together and had all this knowledge about his so-called corporate days, or this or that, and fashion and cologne, and was it all an act? Was it all a shtick? So that's it for that portion. We just see blood tested, no testing performed, here, there, blood, this, that, qualitative, quantitative. That's what we have right there from Dr. George Bionic, laboratory director. But let's look at the report of the medical examiner. Now this gets a little bit more detailed. I learned the other day that an ME medical examiner is more knowledgeable than a coroner, and this report bears it out. We see right up here, Kevin Samuels, 53-year-old black male, cause of death, hypertension. Manner of death, natural. So that means no foul play. They are not suspecting that someone slipped something in his drink or poisoned him, or, all these, oh, look at that woman, she was holding a drink and look at her walking past him and what was in that drink, and all these theories. We have Dr. Karen Sullivan signing her name to this. That's what happened. What's really interesting, the reason for performing this exam was because this 53-year-old black man with no known past medical history suffered a witnessed collapse. Indeed, Hortensia told 911 that Kevin fell on her. So we can imagine it was really early in the morning. We can imagine maybe what was going on, and he just collapsed. He was transported to Piedmont Hospital where resuscitative efforts were unsuccessful. We'll do this quickly, everything they went through, and it's pretty interesting to hear some of this stuff. Manner of death, natural, cause of death, hypertension. She wrote, "It is my opinion that Kevin Samuels died due to hypertension, high blood pressure. Evidence of hypertension includes a heart whose chambers are thicker than normal, ventricular hypertrophy. Amiodarone is used to treat cardiac dysrhythmias, including atrial fibrillation and supraventricular and ventricle tach is easiest to say. Abnormal heart rhythms associated with a rapid heart rate. Atenolol, as we went over, is used to treat hypertension, high blood pressure. The manner of Mr. Samuel's death is classified as due to natural causes." Now, natural causes, of course, means no foul play, but it's confusing because sometimes you will see a 23-year-old gone from natural causes and it's still shocking. That means it wasn't at the hands of another. But that doesn't mean it couldn't have been prevented by a person's lifestyle. So they performed the autopsy Friday, May 6th at 1300 hours, so that was 1 p.m. The body was received supine in 2 white plastic disaster bags, and they talk about how it was secured. It had the tag Kevin Samuels. A partial denture is released with the body. No other items are on or accompany the body. They go through how everything was stabilized. He had superficial abrasions on his chest, consistent with resuscitative efforts. You focus on if you need to do CPR on someone. Sometimes they actually break ribs, but you think of that song, staying alive, staying alive. So that's your rhythm. That's what you think of. You focus on that more than mouth to mouth at all. It's important to try and do that. But it didn't work. He had 6 electrocardiograms tags on his torso, a blood pressure cuff encircling his left arm, a catheter in the left leg, a trach tube in the mouth secured with plastic. They were doing everything to save him. Being as sensitive as I can to read the rest of these details, the refrigerated body is cool to the touch. Rigor mortis is generalized and well developed. There's violet postmortem lividity distributed except in regions of pressure, so that makes sense, where the blood pools and doesn't pool. The corneas are clear. The borders of the lips are moist. Interesting. The body's well preserved. It was an unembalmed body of an adult black male appearing consistent with the reported age of 53 years, measuring 76 inches in length and weighing 219 pounds. So yeah, he was pretty tall. He measured 76 inches in length and he weighed 219 pounds. So yes, that makes sense. And he was still relatively thin because that's 6 feet 4 inches tall. And of course, the taller you are, the more you weigh. So I see he did way more than me. I'm like 5'11". He was 219 pounds. He came off as a relatively slim man because he was so tall. He had so much height. It says the decedent has a large build, well developed and well nourished. So his BMI was less than 27. His BMI was only 26. That's a good BMI. The black and gray head hair is about really short, 1/1/16 of an inch to 1/4 of an inch in length. So yeah, he kept a nice low haircut. Facial hair is 1/8 of an inch in length. The irides or irises are brown. The natural teeth are in average repair. Numerous teeth are remotely absent. So he was missing teeth, and so that makes sense of why he had dentures. I'm not sure if we knew that. Each earlobe is pierced, and there's monochromatic tattoos are on the torso and extremities. I never really paid attention to any of his tattoos. There is a 9 1/4 inch scar in the abdominal midline, and it involves the umbilicus. That was a huge scar, like nearly 10 inches long. I don't know if that was related to his previous cancer, if he had any surgeries, or something else. There were other scars on the right side of the chest and scars other places. So he had one huge long scar and 5 other scars. Another one was pretty long too, 5 1/4 inch scar. So one was a really long scar on his foot. I don't really know his entire history. Maybe he's spoken about scars, maybe previous surgeries, injuries, fights. I don't know what happened. There is no evidence of acute injury. They speak of his normally formed head being atraumatic. No blunt force head trauma, nothing they could find there. The soft tissues of his face and neck were plethoric, like full of fluid and blood. And facial bones and mandible are free of palpable fractures, so no broken bones in his jaw or his face. Neither ocular nor facial petechia are present, so that's important. Neither ocular nor facial petechia are present, so that makes sense. When people have been strangled, you'll see petechia in their eyes, indicating usually they've been strangled. Now he does have the sclera are anicteric, which means the whites of his eyes basically were still white. He had congested blood vessels, so I think that's kind of maybe normal. The blood vessels, I believe, in his eyes were a little congested. The nose is normally formed. His nasal vestibules were clear. His lips, teeth, tongue, gums, buccal mucosa are unremarkable. Everything else unexceptional. The trachea is in the midline of the neck. The neck is neither crepitant, it's not grinding or creaking, or excessively mobile. I guess it wasn't all over the place. No palpable masses were present. His chest and back are symmetrical and well developed. For those of you who have watched his shows, and forgive me for people who really just love and care about him, it's almost like you can hear him saying, "See, my chest and back are symmetrical and well developed." You can almost hear him bragging about it. The abdomen is devoid of palpable organomegaly. Apparently his abdomen was not enlarged. The spine is straight and free of injury. His extremities are symmetrical and well developed. The appendicular skeleton is stable to manipulation. The hands and feet are normally formed. All his digits were present. The closely trimmed nails are free of underlying debris. You can tell that makes sense. His nails were, well cared for, no dirt under his nails. And what's most important is people look for, DNA, defensive wounds, anything they can find under the nails. The penile foreskin is short. Now, before you go thinking what I first thought, in my opinion, that probably means he was just circumcised like most men who aren't Jewish. The testes are palpable within the scrotum. The external genitalia, perineum, and anorectal areas are normally formed and atraumatic, so nothing bad was going on down there. Other regions in the buttocks were unremarkable. No cervical, no swelling of the lymph nodes around there. And they even go into his head. The scalp is reflected using the standard incision. No scalp trauma. Everything's intact and free of discoloration and thickening. The base of the skull was examined. Now, they did find a pink fleshy mass in the middle of the anterior cranial fossa, grossly suggested of basically a tumor. But I don't know if this was something that's benign or not. They're saying it could have pressed on other nerves. So I'm not sure if that would have informed his thinking at all or not. Some people just have benign tumors that don't affect them at all, while others may grossly affect their life. Basically, no hemorrhaging was found. They weighed his brain, 1,500 grams. Normal distribution and development. No lesions of the white matter, deep gray matter. Nothing indicative there of natural disease processes. No brain swelling or herniation was noted. Normal distributed blood vessels. Spinal fluid was clear. They talk about the skin of his neck being dissected to the angle of the mandible, which is basically the jaw. The tongue is atraumatic, nothing there. No trauma of the soft tissues, airways, vital structures in the neck. Hyoid bone intact. That's a big one. You know, a lot of people who have been choked to death, their hyoid bone is usually damaged. Laryngeal cartilages are intact. No foreign objects were in the airway, so he wasn't choking on anything. They talk about the skin of his chest and his abdomen reflected using the usual Y-shaped incision. The subcutaneous fat was only 3/4 of an inch in thickness at the level of the umbilicus. So wow, that's not much fat. You know, he looked thin. So yeah, only 3/4 of an inch in thickness of subcutaneous fat at the level of the umbilicus is pretty thin. Upon removal of the sternum and chest plate, there were no abnormal fluid collections noted in the body cavities. No unusual odors or color changes were noted. There was an intact diaphragm. They weighed the heart. It had a normal 4-chambered anatomy, different thickness. Now, this seems weird. Metal staples are in the periaortic soft tissue just above the bifurcation of the aorta in the pelvis. Perhaps that was from that heart cath type of procedure we read about earlier. Everything, his respiratory system seems normal. Trach, major vessels normally formed. They weighed his lungs, and neither one exhibited anything like thrombosis, embolism, you know, like blood clots and stuff. His esophagus seemed normal. The small bowel, colon, rectum normally formed. A small amount of tissue is suggestive of an appendix remnant. I guess he must have had his appendix removed at some point. Maybe that accounts for those scars we, discovered earlier. They weighed his liver, his gallbladder, kidneys, and I will keep a lot of this on the screen if anyone wants to take screenshots and just read it all for yourself, especially medical professionals who are really interested. Spleen seems normal, and there was fractures, so we talk about that. His ribs were broken. Anterior fractures of the right and third ribs are consistent with resuscitative effort. Otherwise, the skeleton is intact and the skeletal muscles are symmetrical. So with those broken ribs, like I said, sometimes if you're doing CPR correctly, it can break ribs because you're trying to save a person's life. So the ribs don't necessarily matter as much if they get broken, if it helps to restart a person's heart. Other than that, thyroid gland seemed normal, adrenal glands of normal size, pituitary gland of normal size. So they looked at the heart, the lungs, the kidneys, the liver, the pancreas, everything. Seems like from what I'm reading, they did a thorough job. The blood and urine were submitted to the other place I read, Axis Forensic Toxicology. So that's a separate part of the case file, which we've already looked at, and looked at blood and everything. And the denture was released with the body. As we close with Ephesians 2:8, let's say, "For it is by grace that you have been saved through faith. And this is not from yourselves. It is the gift of God, not by works, so that no one can boast. For we are God's handiwork, created in Christ Jesus to do good works, which God prepared in advance for us to do." And that's all I want to do is good works. Thinking about Kevin's death, it's really fascinating to me, sad to me, because here was this 53-year-old man. If you read the book from his beautiful ex-wife, her book of poems, you will see she hints to a hard time with a man who, I don't know if he was a megalomaniac or narcissist, whatever it was. It's very sad to me when we have, the face of a supposed Christian, but not the heart of a Christian, not the heart of a Christ follower. Maybe a person like him was. I always ask God, is this person, did they really believe in you, or was it the thing to do? Churches were hot and popping in Atlanta, especially back in the day when Kevin was coming around. And maybe it was something to do. Maybe it was something he did with his wife. but it didn't work out. When both of his marriages failed, he adopted the new philosophy. He called himself a simp or a sucker back then, trying to make it work with these women, these women who are too bossy, and there's so much to get into with this case, but his death can represent so much more. And I'm not on either extreme. I wasn't jumping for joy that he died. And I'm not some big fan up his butt like, oh yeah, red pill, blue pill, high value men, rah, rah, rah. I try and look at things logically and spiritually and try and seek the spiritual truth. But I do think there was a lot of fakery going on, and there was a lot of hitting on a subject that kind of just dogged especially Black women a lot, and especially overweight women, and especially older women a lot, where it was unnecessary, where, God compels us to come to him through love, not through hate. And even if we hit on something that might become popular, I feel like we still have to think about you, the other person. Like, I'm looking at this green light on my iPhone, and I have to realize there is another person on the side of this video that will watch it, will take it to heart. The Bible says, teach us to number our days. Like, we only have a finite amount of time. And if I hit on something that, ooh, man hating was popular, let me jump on that bandwagon. I mean, I've unsubscribed to some people just because, I'm with them at first and then they go way too hateful. We've got to win people no matter who they are with love. I could jump on some man-hating bandwagon because it's popular and, ooh, what if it could make me a lot of money? But then we have to meet our maker one day. And so we have to ask ourselves, what is worth it? I could go charge up a bunch of fancy dresses and, wear them and take them back, or pretend like something was wrong with them, or try and scheme and scam. And I'm not saying I'm above it all. I'm just saying more and more of the truth is being revealed, especially as we get on YouTube. And if we're trying to be these people that we are not. I'm not saying viewers need to see everything. I'm saying we just have to remember God is watching all of it. And we want these works prepared in advance for us to be aligned. I'm always saying align my will to yours. Some stuff might look good. Yeah, I might be able to make a lot of money doing other stuff, but would I be able to sleep at night with my soul? Imagine if I turned into the female Kevin Samuels and I was trying to teach younger women, yeah, or if I was trying to teach older women, yeah, go get you a younger man and do this and do that, and who cares about marriage and blah, 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 blah. And heaven forbid, God might say, okay, if this is the path you're going, your time is up. And so I don't want that. I want to be satisfied with long life, and beyond that, I want to go and do his will. This blends all into Kevin's death in my mind, because not only were we the same age, and we basically kind of had the same career as a YouTube creator. Apparently we were both Christians, but I feel like we were on these paths that went like that. And I guess I'm trying to, I just want to reverse any damage that was put out there from younger men, from older men, that Kevin may have put out there, claiming certain races are more valuable of women than another. Or, if she's too successful, don't get her. Or if she's too overweight, don't, all of that. My main message is that is not of God. That message, no matter if you want to slap a Christian label on it, or I'm being real, or whatever it was called, that is not of God. God says we are fearfully and wonderfully made. He does not say you have less value if you are over 35 or over 200 pounds or whatever used to be espoused on that channel. And it's sad to me. It's not a celebration. It's sad. I think I watched his funeral. I watched the people who loved him. I watched the people he inspired. I appreciate him, touting a good work ethic for men and saying, get out there, make your money. But unfortunately, I know he talked about attacks on marriages and all that, but I just wish his message could have been more positive and more real, more Christ-focused, more Christ-centered, since that's what he claimed. And use his humor and his talents, because he was funny and he was talented and he did have good looks, and all of that I feel like just ended and went the wrong way and was wasted. That's my main message to you. Let's not use these talents that God gave us to especially, shift people younger people, anyone, in the wrong direction. We're older and we should know better. I want God to keep blessing me with his positivity, his blessings, and, well done, good and faithful servant. Did Kevin hear those words? I mean, I hope so. God doesn't want anyone to perish, but I don't know. It just, it makes you feel icky and weird when you see something like this happen. But we shall know as we are known. So let me just end it there. I'm still digging into the Andrea McRae Justice for Vaughn case. I'm soaking up so much research, so I plan for that, hopefully, to be my next video. We will see what happens when I can get that out. But thanks for watching this one, all of this, and I think that's it. I'm gonna have to go run to the dentist, so I had to get this done while I can still speak clearly. Another lesson we can learn from Kevin's death is to try and take care of ourselves the best we can. Not just the outward, but, the inner man, the inner woman as well. Let's not be filled with hate and bitterness, but just lead through love and try and be humble and not pretend like we've got it all going on. So there we go. Thank you so much. Stay tuned for the next video.